what else I can figure out to do for people. So some of it is the mirroring. The body likes to mirror itself everywhere. So you could do left shoulder to treat right hip or vice versa. You could do left elbow to treat the right knee. We can treat people with phantom limb pain. So they have a limb gone, but it hurts, so we'll do the other one, or we may do the opposite foot. Very interesting. So the energy, they say, is still there even though the limb is gone. That's why they have pain. Yeah. Yeah, I saw the question bubbling up.
Well, I've got a whole bunch of them.
Okay.
I'd like to dominate the conversation.
That's okay. It helps me. Go ahead. It keeps me on track.
Everything in traditional medicine has everything in different places, kind of. I mean, everybody's got it different. You know, like everybody's heart isn't exactly in the same place. Mine is.
Right.
Some people actually have more over to the right side of it.
Mhm.
The arteries are all different. How can you be taught to put the needle in such a certain depth?
So we measure. We use our fingers. This width we would call 1 sun. So there's a point here that would be 3 sun of your finger on you, 3 on mine, and that's how we measure. Over time, some of us can become energetically sensitive, so almost like you know what a dowsing rod is. So you can just trace your finger over and just feel the energy after time. It's in there, it's measurable. The scientists want to disprove acupuncture. Some of them don't understand it, so they run all these tests and studies and take pictures. And the points are measurable electrically, magnetically, and then the results can be measured thermographically. That's where they take the pictures. So you have your sore knee, it's red, it's inflamed. They take a picture of it with whatever the machine is, and it's going to show up red, orange, yellow. Then they put acupuncture needles in, let them sit, take another picture. It might be more yellow and green, so it's showing that it's cooled off. So it has been measured. And then you may read articles about sham acupuncture. In my opinion, there's no such thing as sham acupuncture. So I could whap my arm on the table and have a lump. There's no acupuncture point necessarily right there. But I could put needles and surround that lump, and the lump will fade and will go away. It doesn't have to be on an acupuncture point. The acupuncture points themselves have set functions, but you don't have to put it right in there in order to elicit some sort of response. So we talked about the measuring. We look for landmarks because we all have landmarks. So let's say the elbow bone, we'll look for it, and then you measure again. So maybe your elbow bone is in a different spot than Cheryl's, but we still use your set of fingers as a measuring tool. Does that make sense? A little. So we use landmarks. So, you know, the knee has the dimples right underneath. That would be a landmark which we would use for measuring. Or the bone back here, that's another landmark. So you know, sometimes you're looking for a point, you're hitting the bone here, and you're measuring right in the middle. That's another point.
Okay. Second part, we're all, well, at least half of us here are heart patients.
Mhm.
There's a few that are ratio. But what can acupuncture do to help as far as the different types, because we all have different things wrong with us?
So again, there's the questions. They start out, they call it the 10 questions. That would be your body temperature. Are you too hot or too cold? How's your appetite? How are your bowels? How are your lungs? Do you have any chest pain? Do you have any abdominal pain? How do you sleep? What's your energy like? How's your reproductive system? How you answer each and every one of the questions gives us clues. So every new person, it's like solving a mystery. So you are all heart patients, but not all of you are going to answer my questions the same. So some of you, or most of you, may have a deficiency in your kidney system. Well, the kidney is very important in supporting the heart. So maybe I would treat the kidney to support your heart. So all those questions help me find out what your imbalance is, if it's too weak, if it's excessive, do we have to drain it, do we have to support it, and then we go from there.
No, I was like one of the first patients out here that had another thing that was developed, I believe, in China. ECP, which Cheryl knows what it is, to grow arteries in your body.
Wow.
And I was told that if it didn't, they would try it on me, and if it didn't work, I'd have to have more bypasses. And it worked. It actually opened up one of my other bypasses. And it's
Wow.
been open for I think 6 years. Any results like that that you can talk about?
Well, we've been told that nerves can regenerate. Blown discs, maybe not completely blown, bulged, can be reabsorbed by the body. When I was in China, they took us down to the massage clinic, and we watched two men grab a woman, and one of them stuffed his foot in the small of her back and seemingly was karate chopping it. It was very alarming, but they showed us the MRI results before and after, and her disc was back in. Now, we wouldn't do something like that here, but you can, again, by bringing the body's energy and awareness to the area with the acupuncture, it can reabsorb. So changing structure, a small tear could heal itself, and a tear in a rotator cuff could be facilitated in healing by having acupuncture. It would depend how severe the tear is and how willing the client was to come in for treatment. The more severe a tear, the more treatments they would need. Most often in this country, we're just geared for the quick fix, just give me the surgery and I'll go. But then you have the whole healing process after the surgery. So more and more people, I think, are weighing their options. You know, do I want to go through the surgery? You know, if it's a single woman with a rotator cuff, you need help. So she may choose to do acupuncture to try to help that thing heal instead of having the surgery. My mom is actually a good example of that. They wanted her to have surgery, and she went down to, well, she lives in Racine where they have the acupuncture school, and she went in there, and she didn't need the surgery, and she was suffering pretty long with that.
How about arthritis?
Yeah. Okay, no, I was talking about the World Health Organization before he broke my doll.
You missed it, I broke her down. It's over to the one that's got the enema right now, it's got the hemorrhoid problem.
Or any type of arthritis was one of the things on the list that the World Health Organization has approved us as being effective for treating. Again, it's getting the attention to the area, increasing the circulation, and that helps take down the pain levels. It works wonderfully. And it's exciting that more and more doctors are recommending it. When I started this 12 years ago, I got the whole, I'm not telling my doctor, or my doctor says this is voodoo, or, and that's, it's kind of a sad event because, what if it could help? Yeah. And it's been around for thousands of years.
How about diabetic nephropathy in your feet?
Neuropathy?
Yeah.
We can help with that. Again, this, because it's a more challenging case, it may take more effort, but it can help. I've actually had quite a few this spring coming in with neuropathy. A little more difficult than that would be chemo-induced neuropathy. But I've been seeing some good changes.
Where does this fit within medical reimbursement from insurance companies and stuff like that?
Medicare won't touch it. More and more policies are covering. You're looking at the bigger companies like Time Warner, We Energies. The trades unions cover. A lot of the trades unions.
But not the standard health insurance policies, they're not.
It's worth a phone call is usually my answer. You may find that some do cover. It can be turned also into a health savings account and flexible spending. Those will cover because we are licensed professionals. If you're in a car accident, your car insurance will pay for it. So bit by bit. I mean, as time goes by, we're making bigger strides and getting more approval.
Is there any help on obesity, other ailments, depression? How can you explain a little bit about that?
Obesity, again, I would do all my questions, figure out if your digestive system is working. Probably it's not, and many of us in this country, I call it the all-American diet. We eat too much dairy, too much sugar, too much bread. I look at all of that, and I would make dietary recommendations, which is part of my training. Things to cut out, no one ever likes that, but if you're serious about it, you have to do some work. If you're coming in for knee pain, I do all the work. If you're coming in for addictions or weight loss, you have to do some work. You can't come in for acupuncture and keep eating Big Macs and expect to lose weight. It's almost not possible.
All right.
Okay.
What about
so-
smoking?
Yes, again,
My son smokes.
I give
I'd love
homework
him
for
to quit.
smokers too, but yes, it can help. It can take the edge off. Again, because it's so calming, it takes the edge off. It helps with the cravings, helps with willpower. There's points for willpower, and then again, I give homework for that too. So there's certain things that I absolutely will give homework for and stomp my feet and get on my soapbox. But depression, anxiety, yes. Again, because it is so calming. But we do the questions. I figure out where your imbalance is, what might be creating those symptoms. So if you have anxiety, it might be different than what was causing Cheryl's anxiety. So yes.
I get some disorders too, so.
And it helps with sleep. Some things, again, can get better more quickly than others. You can take two people, in my own experience, I had two people with migraines. I had one lady, every day she had a terrible migraine, one visit, and it was gone. And the only reason I knew was her dad was also seeing me for hip pain. And I just asked him how she was, and he's like, she's fine, no more headaches, they're gone. I'm like,
She helped
wow.
Alyssa. Alyssa went there right from work one day with a migraine, and
Oh, yeah.
yep, she said,
She's still doing well.
yeah, she is. But she thought it was great.
It's really fun stuff. So on the other hand, another migraine client I have, she's had something called a Chiari malformation. She's had a craniectomy, trying to let a cyst expand, so many things, and all I can do is just get her days of relief. But she keeps coming because, if she's on a 10 of a 10 every single day, if I can get her down to a 7 for 3 days, she can sleep better and, do some activities.
Versus slates,
Yes.
what would you do there?
Again, I would ask all of my questions, but I think that just getting circulation into the legs, I think it's really just chi that's stuck, and it's like butting up its head against a door, and it's not moving, so that's why your legs are kicking, because your body's, sympathetic nervous system, I think, is just trying to kick it loose. I think sometimes your body tries to do things to heal itself. You bump your arm and you're rubbing it. You're healing yourself just by doing that.
What do the needles do with this? What's their function? You put them in there, does it create energy, or does it block something? Or?
It unblocks energy. It can, depending on where you put them, around the crooks of the elbows and knees, those points are really good at draining heat. So, for instance, if somebody had a urinary tract infection, I would pick some in this area to drain heat. There's also another point to drain dampness. So we just pick points according to what we need to do. And again, if you look at the textbook, it's like this big of all the points, where they are and what they do. The best combinations can sometimes be in the books.
What does dampness cause when you say
Dampness.
Like,
So
what
going
would-
back to the digestive system and obesity, dampness it's considered a pathogen. And you get dampness by your diet, usually, sometimes medication. And so again, when I said we don't want it too damp or too dry in the body, if you're too damp, you're probably somebody who's overweight, you're extra tired when it's raining out, maybe your joints ache more when it's raining out or humid. And it's something that you want to drain, something that, like we call it a UTI, would be lower jiao damp heat. So this is the lower jiao. There's dampness and heat, and they're festering and stuck. So we have, in Chinese medicine, the spleen is in charge of transforming and transporting food. So if all you ate was cheese curds and bratwursts, you're going to damage your spleen. So your spleen is supposed to be like a sponge. It's supposed to take the food, the turbid stuff, the stuff that's supposed to be expelled, squeeze it out, suck it up, squeeze it out. Well, when you keep putting all this stuff that creates dampness, it can't do its function anymore, and then it starts building up in the tissues. And then fat becomes the extreme form of dampness. So it's dampness that congeals and becomes fat tissue. Yes.
Can acupuncture help the overactive pancreas from type 2 diabetes? You know, like the constant stimulation and the, you know, or, you know, like kind of in a way obesity too, as far as like the carbs and our Western diet constantly stimulating the pancreas to increase insulin because we're eating so much of that type of food.
So in Chinese medicine, we actually call the spleen, sometimes we call it spleen pancreas. I don't know why they lump them together as one. I may have slept that day in school or something. But they have the same function. They are supposed to support and help digestion. When people ask me specifically about a Western diagnosis they have, what I tell them is we don't always have to know what it is. For instance, I had a woman call me with sarcoidosis of the lungs, and I vaguely, and that's where I was when I was talking to her. I'm like, I vaguely remembered what it was. It was the tissue starts to harden, and she was on higher doses of prednisone. She had trouble breathing, and I explained to her that, you know, the questions we ask, we treat according to what you tell us as far as symptoms. So your diagnosis doesn't necessarily need to even be spoken to us. However, anytime I have something I've never had before, I can always get online or go in my books and look up different things, or there's studies published all the time on the internet of somebody who's treated something. We're given all this knowledge in school, and until actually somebody calls you up to treat them for it, you know you can, but maybe you haven't done it. So one example was a woman who had a 1 week old or 1 month old and stopped lactating. She said, "Can you treat this?" I said, "Yes." She said, "Have you had success before?" And I was like, "Well, I have not had opportunity to treat it yet, but you know, it's in all the textbooks, so I know it's doable." And she came in and she did not want to be in my clinic. She did not want acupuncture, but she wanted her baby to be breastfed. So one treatment, and she lactated for 6 days, and she did one more treatment and never needed another. So to me, it was exciting. I never got to try it, and there we go. But the sarcoidosis woman, so she came in, we went through all the questions, and I figured out what her underlying imbalance was and started treating her for that. And ultimately, we got her down to only needing the minutest dose of prednisone every other day, and her doctor was pretty amazed by it, even though he was reluctant with her coming in the beginning. She's like, I'm going downhill, and I'm going downhill fast. And she just wanted to prolong her life. She had, you know, custody of her grandson, and she didn't want to be down the path she was on. So she did well. It's not gone, it's just significantly better, and her quality of life improved. And less medicine.
It's not what counts.
Out. Yes, that would be another one of those damp heat things that would need draining and circulating. So there's really nothing that I would ever be like, no, I can't treat that, or maybe there would be a couple things, but again, it's just a matter of asking the questions. And then we also, so I keep talking about the questions, we also look at your tongue and your pulse. And so say somebody comes in, they have migraines, and they answer no to every single question I have. I'm like, oof, where do I start then? I could also look at the tongue. So we look at the shape, the color, the size, the texture, the coating, if there's any landmarks. Where they all lie on the tongue is indicative of one thing or another. The pulse also, there's 3 positions on each side. Each one is associated with an organ system. So if they're too big or too small, or sometimes they'll be soggy, which is dampness. So there's wiry would be like kind of somebody who's stressed out or angry a lot. So different textures in the pulses we can find. So we can take those pieces of information too and add it to the 10 questions and come to a conclusion from there. Okay?
Acid reflux,
Yes.
what about that?
I would ask you if you were stressed out. If it happened when you're stressed out, then I would just ask you about your digestion, what you're eating, what time you're eating. So and then energy through these meridians, some of them travel up, some of them travel down. Very often, reflux is your stomach energy going this way when we want it going that way. So then I would pick points down here that would pull the energy down. Any other questions?
You said, or you mentioned blood pressure can be used to treat blood pressure.
It can. It can. I could never ask somebody to do anything other than what their doctor says, but sometimes if the medicine's not quite doing it, it can be a nice
Or do
adjunct.
you want to take medicine for it?
If you don't want to take medicine for it, then if your doctor never prescribed you any or you don't tell me about it, then I would do acupuncture. I would maybe look at some herbal formulas for you, maybe some food changes. I do a lot of diet therapy. There are foods that can drain dampness, foods that can warm you, foods that can cool you. So that's why I do heavily look at diet and often give homework, because it's important to do things from the inside out versus just the outside in.
So it would be diet changes in addition? to-
Potentially. And some people just have high blood pressure. You know, how do you know you didn't have it when you were 12 or just, yeah. But oftentimes it can be stress doing it. So if you calm somebody down, then the stress level comes down and the blood pressure can come down. Or somebody with high anxiety will also sometimes have high blood pressure. So again, we're calming them down.
Years ago, doctors and chiropractors didn't get along. People remember that? Yeah. And they would never refer and stuff like that, and all of a sudden some doctors started to do it. You said some doctors are starting to understand it. Have you had any doctors that weren't in favor of it, now referring people?
That weren't in favor
That
of it?
told their patients, nah, it doesn't work, whatever, but now they saw results on a patient, they started referring.
Maybe not personally, but even with chiropractors, I noticed that, you know, once one person says they're coming, then all of a sudden I get more and more people coming from that chiropractor. Medical doctors, yes, the clients don't always tell me where they're coming from. Maybe I should ask, but they don't always tell me. So, yes, but more and more are referring and are supporting their clients when they tell them they do come, which is fantastic. Because the two can work really well together.
Well, where you practice is a medical doctor. One of once a week, Aimee practices at a primary physician's, it's a center, the Omani Center. And so I actually go to that doctor, and she was always telling me to go to her acupuncturist, and I'm like, well, I'm going to this one in Brookfield, she's really good. And then I've looked up Aimee's name in Oconomowoc. I just looked up Oconomowoc Acupuncture, and then that was Aimee's clinic, or her clinic. And I found out that she worked at the Omani Center. And I go, well, that's the one that my physician was telling me to go to. So then I knew I was going to the right person, so.
Do you ever do reflexology?
I'm not trained in reflexology, but some of it is, I'll just say no.
I'm just curious.
I mean, I understand it. It's, again, the body superimposing, and I don't do it, but I'm not against it. I think if it works, go for it. Have you had it?
Yeah,
I like it.
very relaxing.
Yeah, I had it once on my feet, just to see what it was. And one that if somebody asks me about a certain therapy, I'll go try it just so I know what to say, or.
Because my sister couldn't walk, and she was a reflexologist, and it worked.
Wonderful.
But now she passed away, so not my sister.
Oh, the
reflexologist.
You want to stay with the
Yeah.
facts?
Yeah, but I really enjoyed that.
Any other quick questions? Anybody not learn anything today? No, I did. Okay. Thank you very much.